Hello, everyone. Thank you for joining me. Today, I'm going to walk you through transforming the clinical decision support and clinical analytics landscape through natural language processing and data science. My name is Elia Lima-Walton. I'm a physician informaticist and director of data science and clinical analytics health over at Elsevier. And together with my team, what we work on is developing point of care scalable solutions. Also, we develop solutions for education. In this presentation, I want to talk to you a little bit about what our mission is, how do we operate our community. Also, I want to show you a little bit about what Elsevier's medical taxonomy is, our knowledge graph, and how we're connecting health products and improving interoperability. I want to give you a couple of examples, just walk you through what are those data science capabilities that we're developing. Our mission. At Elsevier, our mission is to be able to help educators, researchers, healthcare professionals to improve health outcomes for the benefits of our overall society. We are an information and analytics business specializing in science and health, and we really combine the unique content that we have, all of our different unique assets with technology in order to turn information into actionable knowledge. These are our 5 main customer segments. We are supporting clinicians throughout their journey, researchers, governments, pharmaceutical companies, medical and nursing students. And in the next couple of slides, I'll walk you through how we're doing that. Just to kind of give you an overview of some of our flagship products, over here, you can take a look at what we have, whether it's Clinical Key or point of care offerings. We have Science Direct, journals, we're very rich in, also educational assets such as SharePath for nursing students, CK Student for medical students, etc. Looking at our data science community, we're truly global. We have over 250 data scientists and clinician specialists that develop solutions, and we have over 8,700 employees over at Elsevier, representing over 180 countries. These are some of the main hubs. We see we're located in Amsterdam, London, Philadelphia, Chennai, and Bengaluru, and we have an artificial intelligence lab in Amsterdam. If you want to learn a little bit more about some of our research projects, you can click on the link below. In data science health, who we are and how we operate, we typically work closely together in squads. Our teams and squads are formed by data scientists, clinician experts, physician informaticists, nurse informaticists. We have data analysts, also localization experts on the teams that work really closely with our content strategists and product partners and taxonomists in order to develop the scalable solutions that we deliver upon. The different hubs as located in that map below from our team. My team is Data Science and Clinical Analytics Health, and this is a quick view of some of the brilliant talent that we have on our team. And as mentioned, there's data scientists, clinicians, and also localization experts, and some of the different capabilities that we're working towards. So there are 3 main capabilities that we're prioritizing and developing throughout the solutions we're working on. The first one is really targeting search and discoverability using natural language processing and machine learning. For this, we're looking at concept tagging, improving the enrichment of our in-house taxonomy for information retrieval and the overall user search experience. For standardization of metadata and normalization of new technologies, we're building APIs and new solutions to really help with normalization and integration so that we can connect all of our content assets, whether they're text or images and multimedia assets together. And then our third segment, which we're really working towards prioritizing, is on globalization and localization. And this part really has to do with adapting all of our different products so that we can have the look and feel for each of the different locales from the customers that we serve. Just to take a look at some of the different problems that we are working on solving, we are working on converting unstructured content into structured content, and this could take many different shapes. You can see clinical notes, for example. We're also extracting content from radiology reports, image extraction. We're extracting histology reports, pathology reports, biomarkers, content that's really embedded within our content, whether it's in books, journals, or also multimedia. And we're improving also educational alignment and educational curriculums. We are doing this with the use of taxonomies, which I'll talk to you in a bit, like to learn a little bit more about what sort of taxonomy and the how. And we're aligning our content also with reference terminology such as SNOMED CT, ICD-10, ICD-11, RX norm, CPT, LOINC, NICNOC, NANDA, and other vocabularies. Taxonomy for synoptic content discoverability. So if we want to look at the definition of a taxonomy, we see it is the science of identifying and naming species and arranging them into a classification schema. On the left-hand side of the screen, you can see a simple example, the animal kingdom. We can take a look, we can see there are different animals there. And if we focus on one type of animal, such as the feline, we can start to look at and think about the different types of cats. So there's a domestic cat, there's a lion, there's a panther, etc., all the way down to the more granular child concepts. If we start to get a bit more sophisticated, we start to introduce the notion of ontologies, which is a bit further than just is a relationship or parent-child, but into the relationship between different types of content. And so different types of concepts. So for our purposes, we're focused on medical concepts. And so we start to think about a certain, say, for example, a disease that is connected or related to a different type of drug or diagnostic modality. How are the different medical concepts related to each other? And all of this information, the taxonomies and ontology, really helps improve decision support for clinicians at the point of care that are looking for concise, actionable answers. Elsevier's medical taxonomy. It's available in English, French, Spanish, German, Brazilian, Portuguese. We're also doing pilots in Arabic, Chinese, Somali, Nepali, and Armenian. This is to really reflect how we're working towards being a truly global company and how we want to make sure that we are serving the different customers in all parts of the world. It's a concept-based ontology in that all concept synonyms, labels, translations, and mappings are related to a unique identifier, which is called IMUI, and it's stable. This is important in case a concept ends up getting deprecated, the unique identifier will also be deprecated. In ontology, examples are symptoms of a disease, treatment procedures of a disease, complications of a disease, screening procedures. There are a total of 16 different semantic relationships that we curate. And as mentioned in a previous slide, we're also mapped to international medical standards, as listed here, SNOMED CT, ICD-10, CVX, and also Elsevier's internal vocabularies such as Gold Standard and the Dorland's Medical Dictionary. It's continuously curated by a clinical medical team of experts and taxonomists, and all of this information in the taxonomy actually feeds into our knowledge graph that is powering search by harvesting over 400,000 medical concepts, over 1 million synonym labels, over 220 semantic relationships or ontological relationships that are in the form of triple associative relationships. And we are available in different languages. On the left-hand side of the screen, we can see the taxonomical component. And if we take the mere example of breast cancer, we see that the concept is breast cancer, has synonym labels associated with it, such as malignant tumor of the breast, breast CA, malignant breast neoplasm, etc. And all of this, what it does is it allows an application to know that a certain term is associated with the corresponding synonyms, and it knows that when building an index, it can identify the same terms throughout the different content assets, identifying it to one unique identifier. In this case, IMUI 2790981. We can see there's a poly hierarchy. So there are multiple parents, multiple children down below, different types of breast cancer. And we can see that the content is organized into buckets called STY groups, semantic categories that can virtually classify the different types of concepts into big groupings. We also see the mappings that are associated with each of the concepts below. And then if we want to start to think about how do we really help our users find what they're searching for, how do we pull information that is embedded within our content, within our vast journals and books, we can start to think about the questions that clinicians are asking for, which are, what are the types of screening procedures associated with a disease? How do I screen for a disease? What is a diagnostic workup? What sort of gold standard treatment is there available? And what is a common differential diagnosis for a disease that I'm actually querying? And so we have over 16 different relationships that we are automatically extracting and also validating. Our clinicians, SMEs, are validating these relationships and content. And in this visualizer, we can see what that actually looks like in a representation. Our taxonomy is actually used to help power search for over 20 million content assets, and it has an autocomplete search functionality, which can allow more accurate search results. It has a query refinement, and it has faceted navigation. As we see in the example on the right, we can actually see how there are different pill forms that can allow a user to actually dive deep into the different aspects of a content that they want to learn about. And the content, just to add, it is available again in French, Spanish, Brazilian, Portuguese, and German. So the taxonomy and the ontology is really useful in helping break silos, connect content, peoples, and different content assets. We are able to adapt and identify semantic patterns using the taxonomy, and it can really help identify novel relationships whenever we're thinking of what sort of clinical decision support offerings we have. One use case that we have using NLP is with triple extraction. So looking at those ontological relationships where we want to extract content within our books or journals that is supporting what is evidence-based practice for symptoms, treatment, diagnostic procedures, and drug relationships from our medical content. In this example, we've extracted over 4.2 million clinical relationships through our models, and we have then included SMEs, subject matter experts, in the loop to validate the auto-extracted content. All of this content can be used, all of these triple relationships can be used to further develop a system that can improve information retrieval and can help guide clinical decision support, which can add value by improving accuracy of treatment, reducing patient cost, and also reduce malpractice litigation by having improved accuracy of a diagnosis. Another example that I want to show you is on this method that we've created to identify the trajectory of different decision trees. We've used a computer vision based AI system approach where we're able to identify the correct trajectory of different decision trees, identifying the seed concepts at the very top, what a decision tree is about, and then identify whether or not it's a decision tree on diagnostic procedure versus treatment procedure that can help and aid at the point of care for clinicians that need quick answers. And also thinking about the use cases for education, these decision trees, having this capability in automation can also help with developing permutations of different question sets for query for generating Q banks, for example. It can help for rapid remediation. It can help for having students have access into how to better answer their questions that they're using to drill for their board examinations. In this example, I want to show you what sort of data science tools and domain expertise we're using to provide automatic taxonomy alignment and localization for information retrieval and search. In this case, we're taking a source book, which could be in any language. In this example, we're seeing it in German. So the book content can be available in PDFs or XML. Ideally, of course, XML, nice and structured. But if it isn't available in XML, we can use computer vision to extract the content from abbreviations, from lists of indexes, of glossaries and appendices. And what we're doing is we're sitting down with our subject matter experts to decide which of the different lists can be appended or can be extracted to be able to identify key terms that should be prioritized in our taxonomy. We are deduplicating the terms. We're then running a gap analysis, and we're sending this out to our subject matter experts to develop our taxonomy further. And then there's also a localization component where we're adapting the different vocabularies to each of the different locales. And then we're loading it for re-ingestion so that it's available for term-based memory, which will be used for interoperability of our different content assets. We're also empowering clinicians and students to discover content with topic pages. And in this example, what I'm showing you is a topic page on the right. Essentially, it's a snippet, synoptic content that pretty much can guide a clinician or a student to learn more about the subject that is presented at the top. In this case, it's rheumatoid arthritis, and we were able to extract sentences using the BERT model to be able to identify which are those candidate sentences that are going to be supported from our content, our vast corpus of content. We're also able to suggest related terms that we see on the right-hand side. So it could be that a user wants to find what are the different differential diagnoses for rheumatoid arthritis, how do I treat it, what sort of diagnostic workup should I be doing for rheumatoid arthritis. There are different synoptic pieces coming in from our medical calculators or journals or books. And a lot of these different terms that you see in blue are hard-coded and hyperlinked to show other pages that can guide a user into learning more about this content that they want to learn more about. And so the topic pages are indexable and searchable on Google. And the impact is that we have over 23 million visits on average per month, with over 20 different disciplines and 363,000 topic pages, which are hyperlinked in 5.8 million journal articles. So it's a lot of content available through our Elsevier platforms. If you want to learn about what goes on behind the scenes, there's a bit of heavy curation. We're using natural language processing for auto extraction. And then we have our subject matter experts that validate any of the content that is going into these pages. So it could be that there are different images, histopathology images, or it could be macroscopic images, such as these pathology images in the case of diffuse dermatitis that I'm showing you here. And then there's a part where any of the sentences that are auto-extracted with our modeling are then validated by the clinicians to then categorize and classify which sentences are appropriate for the different terms that are appearing, as seen below. Another use case that I want to present to you is on guidelines and surfacing guidelines and building different types of bots to improve discoverability of content, whether it's for authoring or also for our clinicians at the point of care. And just to highlight, in this example, I just want to present to you some data showing that 8% of guidelines within the United States are non-indexed. If we look at, by contrast to Argentina, this is 84% of guidelines are non-indexed. And in other regions in the Middle East, we can see that that percentage is much higher. This makes it a lot harder for people to find content that is really relevant and finding actionable insights quickly at the point of care. So one solution that we've come up with has been on developing a smart surveillance bot for mining dynamic guidelines. And so essentially, as you can see in this prototype, we're able to start to query, index, we're able to index what a user would be querying. And in this case, if a user is typing in peripheral artery disease, they are able to start typing, and then relevant guidelines would be auto-populated based on what is being searched by using the taxonomy in the backend. We're also able to pull in relevant related terms using different modeling techniques, which could be how do you treat, how do you diagnose, what are the differential diagnoses I should be thinking of with peripheral artery disease. And this prototype, we're also able to show different domains and specialties that can make it easier for a clinician to hone in on what sort of domain they're actually searching for, and then figure out, like, do we want a guideline that has both therapeutic and diagnostic versus preventative or screening type treatments. And we also added an additional feature, keeping globalization in mind, with including different languages to index the content. So it could be that a guideline is actually available in English, but the user's native language is in Chinese. And so we're able to surface the guidelines in the Chinese language. And so this really empowers our clinicians and customers to better find what they're diagnosing and how do they treat their patients in a timely fashion. In this example, I want to show you what we're doing in the radiology image space. We are not only extracting content from radiology reports, we're also doing image analysis and extraction, which can help really identify deleterious signs at the point of care in a hospital setting. And what we're seeing here is images taken from CT scans and also X-rays. And we are essentially able to segment the different areas that are showing up as problematic or showing signs and symptoms in a radiology report. And we are processing it through our model, and we're extracting key key areas that will need to be then analyzed and extracted in order to produce a diagnosis. And so this is the workflow that we have. And with this, we can actually also start to think about what are the different prognostic outcomes, what are those different features that are going to be indicative of, accompanied with lab reports of what sort of diagnosis do we have in front of us. In the next example, I want to show you what we're doing in also for point of care and for education. We are developing we've developed an algorithm that is able to extract content from tables at scale. And this is very helpful because by identifying the content, this tabular content, it really helps empower extraction of the associative triple relationships, which could then be curated by our clinicians in order to improve information retrieval, decision support, and also improve authoring at the point of care. So over here, this is the process that we have in place, our pipeline for content extraction of the tables. We can see this example of causes of diabetes insipidus, whether the content is available in PDF or XMLs, and then we can extract it into triples as seen in the diagram in the right. And all of this can then be curated by subject matter experts to then feed into our knowledge graph. In this example, we're also using natural language processing embedded with our deep learning techniques to create predictive analytics to pseudonymize data and also create synthetic data sets that can be used in identifying different trends within a hospital setting. We can identify areas where there's an increase in patient admission, where there are shifts in care team utilization, where a hospital may want to improve their staffing, whether it's for nurses, physical therapists, physicians, where we can start to predict what sort of flow is in a particular hospital setting in a particular geographic region by a zip code. We can also concept tag all of the different most popular diagnostic codes within a hospital and start to make predictions on what sort of themes of treatments are most present in a certain setting, and what sort of medications should a hospital be planning for, and ensure that they have resources stocked. In this example, I want to show you one of the prototypes that we've developed using NLP, which is on automated patient-to-trial finder to improve access to care. And in this case, what we've done is, we know that clinical trials are the cornerstone of evidence-based medicine, ensuring that the practice of treatments is available for different human subjects. And really what we're doing is we're customizing the trial finder journey for clinicians and also patients by targeting the different clinical findings that are unique to different patients, and the demographics that are unique, the biomarkers that are unique, and also looking at what sort of lab values that would be typically included in the inclusion criteria or exclusion criteria. So in this way, we're able to create this filtering system that can accurately identify what clinical trials are actually recruiting, ongoing, that would be of interest for a particular patient profile, so that we can really improve the treatment, what is available for the different types of treatments, where sometimes there's not enough time and just it's difficult to really identify who would be available for what. What are we doing actually using natural language processing and AI to improve our educational offerings? In this example, I want to show you what we're actually doing in the space of education. We are automating the creation of transcripts. We are also automated the extraction of key terms within transcripts for metadata and extraction and interlinking different content assets. In this case, I want to walk you through the journey of, say, a medical student in their second year of medical school. They are searching for hepatitis, as we see in the example on the right, and maybe they want to learn a little bit more about how do they improve their knowledge base. And so we can see by querying at the top, the student actually searches for hepatitis and they see certain foundational books that are retrieved. In addition, they're able to see certain videos related to hepatitis, different types of hepatitis that can help reinforce their learning. And then in the bottom, we also have images, which is really interesting because not only are they learning at the very basic level in the anatomy, say in the first 2 years of medical school, but then they start to explore what would be expected in that third and fourth year of medical school training and how would they transition to practice by learning what hepatitis looks like in a CT scan or an ultrasound. And this really helps with connecting our different content assets and helps, most importantly, our students through their learning experience. In this example, I want to show you what are we doing for some of our stakeholders that are internal. The problem came to us where we were asked if we can help with identifying certain areas that might be of bias within content. And so areas of bias could be that a certain individual is marginalized by ethnicity, by race, by religion, by age, sexual orientation, sexual practices, disability, etc. We identified these different areas and we developed a prototype using natural language processing and deep learning to be able to classify these types of features into a model that can do it algorithmically. The impact was that we identified content, all these different areas where initially there were, say, 10% of the content may have had areas that were may have had these types of biases. And now by improving the system using NLP, we've been able to vastly drop down the time that it takes for authors to actually validate the time. And the result is that we have content that is not offensive, that is hopefully aligned with what the authoring team wants to see, and that is respectful of different types of peoples and the customers that we serve. I want to leave you with this final thought from our president of clinical solutions and also CEO of healthcare businesses at LexisNexis, Josh Scholler. And what he says is that at the heart of improving healthcare is effectively applying outcomes-driven analytics across the care continuum. I'm excited about the tremendous opportunity to combine the market-leading evidence-based content and clinical reference and workflow solutions of Elsevier's Health with our differentiated data and analytics capabilities to support healthcare providers in delivering better outcomes for our patients. And essentially, this is our core mission, is really improving science and outcomes for all of our customers, whether in patients and clinicians and researchers, wherever they're located, whether it's in North America or all the corners of the globe. Thank you so much for listening. And if you have any questions, please reach out to me at my email, e.lima@elsevier.com. And have a great day. Bye.